How does communism view the role of education and healthcare in society? If you're curious about how communism approaches education and healthcare, you're about to uncover some fascinating insights. Let's break it down step by step. In a communist society, education is seen as a powerful tool for social change and equality. The idea is that everyone should have access to high-quality education, regardless of their financial or social status. This is rooted in the principles of Karl Marx, who believed that education should be a means of emancipation, enabling people to engage in critical thought and contribute to the collective good of society. Communist educational systems often prioritize vocational training, aiming to equip people with practical skills that benefit the community as a whole. For example, in the Soviet Union, Cuba, and China, educational reforms were implemented to end illiteracy and provide equal educational opportunities. In Cuba, after the 1959 revolution, Fidel Castro's government made significant strides in achieving high literacy rates and universal access to education, while also emphasizing civic education and critical thinking. However, the implementation of communist education has not been without its challenges. In some cases, like the Soviet Union, education was used as a tool for political indoctrination rather than fostering critical thinking. The curriculum was heavily influenced by Marxist-Leninist ideas, and teachers were pressured to follow party lines, which sometimes led to the suppression of dissenting opinions. Healthcare in a communist system is also viewed as a fundamental right. Theoretically, communism advocates for universal social welfare, including improvements in public health. The goal is to provide equal access to healthcare services, ensuring that everyone receives the medical care they need without financial barriers. In practice, countries like Cuba have made significant strides in public health, with a strong emphasis on preventive care and universal access to medical services. Communist ideology supports the idea that healthcare should be a public good, not a commodity. This means that healthcare services are provided by the state, and everyone is treated equally, regardless of their economic status. For instance, in a communist system, the government owns and operates healthcare facilities, ensuring that everyone has access to necessary medical care. In summary, communism views education and healthcare as essential components of a just and equal society. Education is meant to be a liberating force that promotes critical thinking and social consciousness, while healthcare is seen as a fundamental right that should be accessible to all. While the theoretical benefits are clear, the practical implementation has varied, with some countries achieving significant successes and others facing challenges related to ideological conformity and resource distribution.